Dr. Lisa Goins, nurse practitioner. I am the CEO of Couture Healthcare Limited, a company that's located in Ohio that offers home care services and staffing for providers on vacation. What I'm talking to you about today is the cost of vitamin D. It's often a big concern with our patients that they don't have money to pay for their prescriptions. A good app to check out prescription costs is GoodRx, which is a free app and can be downloaded to your cell phone so that you can check. Plus, a lot of the medical apps that are out there that can go down on your cell phones, download on your cell phones, are also free. Vitamin D is a very cheap and over-the-counter medication. Some insurance companies will let you pay for the vitamin D via your insurance or your health money that you have set back as part of your insurance policy. There's various names for that money that is set back. You'll have to refer to your policies or your insurance to do that. Now, the problem is, what do you do with your self-pay patients? How do you afford the vitamin D? Vitamin D is over the counter. It's basically anywhere between $5 to $10 for a 3-month supply. You can go to some of the vitamin stores or the different health food companies, and they actually will sell smaller amounts of vitamin D for you. Now, if you're in a facility and you need to order vitamin D for your patients because they are vitamin D deficient, be aware that a lot of facilities will keep vitamin D as a stock medication, just like they do their Tylenol and their Milk-O-Mag, etc. So what you can do is find out the dose, and usually the going dose for vitamin D is a maintenance dose, which is 1,000 international units. So if you want to give your patients or your clients a 2,000 dose, you will need to order 2 of those pills. Most companies do have stock medications where they can give vitamin D 1,000 units and disperse it really ineffective. Most companies can buy vitamin D at a very inexpensive cost, and we're talking about $10 for a large bottle that can supplement 3 people or more for a month to 3 months, depending on the capsules in the bottle. Some companies, if they buy in bulk, they can get it cheaper. So you're looking at maybe 3 to 10 cents for 1 capsule. Vitamin D, 50,000 units, runs about $4 to $8 or about $20 total, give or take the name brand and the access to it from the pharmacy or a company over the counter. You can get vitamin D 50,000 units in stock or units as far as a bottle and distributing for your facility. Most of the facilities do not carry that, and it will need to come from your pharmacy. The other thing that patients can do is access over-the-counter medications from a local store or vitamin shop. That way they can absorb the cost inexpensively, and it will have to be checked in by the nurses to make sure that it's the right medicine and the 5 rights apply before giving the medication. What it will come down to is the basic expense for vitamin D correction dose will usually run about $200 total, and you will need to do a 25OH test. Runs about $40. You'll need to do that twice or do it in the spring and the summer. Include the vitamin D correction dose and the vitamin D maintenance dose, and you're looking at spending $200 United States dollars to prevent a hip fracture that will cost you between $50,000 and $70,000 US. So if you look at the cost of what vitamin D is, it's a very inexpensive alternative for a very expensive problem. Thank you. I'm Dr. Lisa Goins, nurse practitioner, CEO of Couture Healthcare Limited, and this has been an informational, educational video. If you like this, please subscribe If you're watching this for a case study, you're doing a great job. I'm proud of you. Thank you very much.